is Colin Richards, and I'm here to talk about health literacy, patient awareness, and ophthalmology. My co-contributors are Dr. Ryan Friedman, Dr. Angela Elam, and Dr. Andrew Goyle. Today we will discuss the definition of health literacy, the scope of health literacy, some patient perspectives, implications and outcomes, and strategies to address low health literacy. The definition of health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. This is different from formal education, and health literacy is independently related to cognitive and sensory capabilities, for example, vision, which can change as patients age. Health literacy is more strongly associated with health outcomes compared to formal education. Jumping into the scope of health literacy. Health literacy may vary by race or ethnicity and socioeconomic status. Low health literacy is associated with being a minority, and there is low awareness of common eye conditions like glaucoma, diabetic retinopathy, and similarly, within some minority groups, around 1/3 have never heard of any eye disease. Those with lower socioeconomic status have associated low health literacy, and half of urban glaucoma patients have low socioeconomic status with associated worse disease progression. Next, we ask, what are the rates of eye disease awareness among patients? Studies show that overall, 1 in 4 are not aware of any eye disease, and roughly 1 in 3 are aware of diabetic retinopathy, cataracts, glaucoma, though half of patients are aware of age-related macular degeneration. Patients are aware of other eye disease, like retinal detachment, angle closure glaucoma, giant cell arteritis, and central retinal artery occlusion at very low rates. Health literacy also includes disease understanding, which requires patients to not only be aware of the disease, but to also have knowledge of the disease, like risk factors, how the disease progresses, signs and symptoms, and other aspects of the disease. Among those aware of cataracts, 3/4 identified excessive UV exposure as a risk factor, and just over 50% knew ethnic heritage and smoking were risk factors. Among those aware of glaucoma, disease understanding was low, with only 8% expressing understanding that there are generally no early warning signs. Disease understanding is similarly poor for diabetic retinopathy, with only 11% expressing understanding that there are no warning signs. There are other aspects that influence health literacy. The level of traditional education is generally positively associated with awareness of common eye diseases, though this association does not hold for less common eye disease, meaning all education levels have gaps in their eye health literacy. Older individuals generally have greater eye disease awareness and better health literacy. There is a positive effect of eye exam history on eye health literacy, though many physicians may overestimate their patients' health knowledge, and those with lower health literacy tend to take less active roles in their medical care. So, how do patients feel about eye health literacy? Patients may not understand the need for eye exams, or that they are at risk for eye disease, as many diseases are insidious and progress without signs or symptoms. Patients agree that knowledge is imperative to taking action, though they feel that they do not receive enough information on common eye diseases. So what are the effects of poor health literacy? Patients with less health knowledge and those that are at a high risk for eye disease attend eye exams less often. Patients with improved health literacy are more likely to adhere to eye health recommendations, like medication and eye exam attendance. Low health literacy is associated with worse eye disease on presentation, worse disease progression, higher healthcare costs, and lower patient satisfaction. What are some efforts to improve health literacy in eye disease? The NEI has created the National Eye Health Education Program, or the NEHEP, to promote eye health as a public health priority and to prevent vision loss via outreach and education. This program focuses on high-risk groups and common eye diseases. The Healthy People 2020 vision objectives recognizes that engaging families, communities, and the nation is critical to ensuring people have the info, resources, and tools needed for good eye health. What is the best way to deliver eye health education interventions? Many utilize a multimodal approach. For example, using a booklet, telephone education, and motivational and testimonial videos has shown success. The importance of spending time with patients has been demonstrated, and short eye disease interventions may improve patient knowledge and eye exam adherence. There is a need to deliver patient education materials at a level that patients can understand, as many resources are above the average level of reading currently. Similarly, these patient education materials should be developed to reach all literacy levels. There are also attempts to incorporate medical students into patient education, with the dual benefit not only of educating patients, but also our future providers in many different specialties. Key points for primary care providers in regards to eye health literacy. The risk factors associated with underutilization of eye care services include lower household income or lower socioeconomic status, African American race or Hispanic ethnicity, a lack of trust, lower literacy level, having fair or poor vision, and being unmarried. Some patient-reported reasons for eye care underutilization include lack of symptoms, being unsure an exam was needed, cost, lack of insurance coverage, and being unsure where to go. This leads to the importance of patient education. Preventable, blinding eye diseases may occur before symptoms, so patient education is key. Timely referrals are important. Understanding the risk factors and recommended referral patterns for your patients is key. Primary care referrals are associated with higher eye care utilization, and at least annual eye exams are recommended for those with type 2 diabetes. In summary, those at high risk for eye disease are often those with lower eye health understanding. Lower eye health literacy is associated with lower adherence, worse outcomes, increased cost, and patient dissatisfaction. It is important to assess your patient's understanding of their disease and treatment. In addition, it is important to take time to educate patients on eye disease, as this has been shown to be beneficial. And of course, it is important to ensure all resources that are available to your patients are of an appropriate reading level.